When people compete for our business, consumers win. Prices drop, quality improves. So now, some good news. A little competition has begun to improve America's health care. Here's an odd-looking doctor's waiting room. It's elegant, and it's open Saturdays. So is this one. And what's this? The doctor is emailing patients. And he gives his patients his cell phone number.
Hello?
I need to be available 24 hours a day. I want to be there when a patient has questions, and I want to be reachable.
So any problem, just give a call.
Bet your doctor doesn't say that.
Blink.
But Dr. Brian Bonani knows he has to please his patients, not some insurance company or the government, because he's paid by his patients.
Nice. Hold still.
He's a laser eye surgeon, and insurance rarely covers what he does.
That looks great.
Reshaping eyes so people can see without glasses.
Hey, Dr. Bonani. How you doing?
Brian Botha met with 4 doctors before picking Dr. Bonani to correct his vision.
Look straight ahead for me.
Brian demanded to know exactly what it would cost.
I can't get away with not telling the patient how much exactly it's going to cost. No one would put up with it.
Thanks a
And
lot.
the difference of $100 sometimes makes their decision for them. Great. Open.
Laser eye surgeons have to compete for their patients' business, and a result of that competition is lower prices.
In every other field of medicine, the price is going up faster than consumer prices in general. But the price of LASIK surgery on average has gone down by 30%.
We make LASIK easy to afford.
Prices dropped even though doctors pay for advertising.
Our surgeons performed over 500,000 procedures.
Hold real still now.
And while the procedure got cheaper, it also got better.
When the lasers first came out, all they could treat was nearsightedness. Nowadays, the lasers are faster, more precise.
She's here, so we'll be right with you.
We see better quality and lower prices in other medical fields where most people pay for care themselves. Cosmetic surgery is another example.
You're going to look like 25.
The average price of cosmetic procedures has fallen because doctors like Jennifer Walden, if they want to get repeat business, have to offer patients a good deal.
Most of the patients that I see are going to maybe 3 or 4 doctors and then deciding on which doctor to go with. Good to see you again.
She makes certain she treats them quickly.
They can book surgery that day.
It's what happens when doctors respond to you, not your insurance company or the government. And it's happening now, not just with elective surgery. We're starting to see providers offer everyday health care, even in shopping centers.
You do not have a primary care physician. That's why we're here.
This new kind of medical clinic, staffed by nurse practitioners, is popping up in stores like Walmart, in pharmacies, in grocery stores. They offer people with sore throats and ear infections relatively hassle-free care, cheap. Lacey Patterson came to this Ready Clinic in Arkansas because she didn't have a doctor or insurance.
Oh, yes, you definitely have an ear infection here.
She was treated quickly and got a prescription for antibiotics.
1 cap 3 times a day for 10 days.
Her visit cost her $49. Most everything here costs $59 or less.
Open 7 days a week, usually late at night, early morning.
But how can they make money?
They're figuring out how to do something faster, better, cheaper. They're responding to consumer demand because they see that they might make some money on this. Profit. And look who's winning. Moms and dads and kids, because they now have easy access to routine health care.
And some doctors find that dealing directly with patients changes their practice for the better. This family doctor in Tennessee said enough to the hassles of insurance companies and Medicare and Medicaid. He won't take insurance. Instead, he offers this price list with low prices. This is so strange. A price list. I never see this. I would think you can't make money this way. It's
Sure you can.
$40 a visit.
Last year I made about the average of what a primary care physician makes in this country. Can't guarantee.
Dr. Robert Berry says not taking insurance saves him time and money.
I don't have to hire billers. I don't have to fight the insurance companies to get the money.
And that lets him keep his prices low.
Have a seat there.
His mostly uninsured patients save money.
It's looking pretty good.
Joe West paid about $200 to have a wound on his head stitched up.
You go to the hospital and they probably charge you $1,000 for the same thing.
Knowing that his patients pay with their money, Dr. Berry works with them, tries to find ways to save the money.
It's coming out of their pocket, John. And they're afraid. They don't know how much it's going to cost. So I can tell them, okay, you have heartburn. Let's start out with generic Zantac, which costs around $5 a month. But I see Nexium on TV. I see Prevacid. Yeah, but that costs about $130 a month. They're great medicines. But why don't you try this one first and see if it works.
And sometimes the $4 pill at Walmart is just as good as the
Oh, yes.
Okay, thanks, Doc.
So when doctors deal directly with consumers,
It's 40 today.
and consumers pay for things themselves, saving insurance for the big stuff,
There's your change.
doctors start to compete, posting prices and working to keep them low. Where consumers decide for themselves, rather than having governments or insurance companies make decisions for them. Competition erupts, and competition gives us more choices.
Excellent.
Choice gives us power. Michael Moore should know that. After all, when he at one time weighed about 330 pounds and wanted help losing weight,
Well, I got some food here.
where did he go? Not to Cuba or Canada or England or France. He went to this weight loss spa in Florida. It's privately run.
Now down in the water. Open.
That's our program for tonight. Next week, Elvis Viva Las Vegas, the 2-hour special, including performances by top recording stars Faith Hill, Toby Keith, Celine Dion, Paul McCartney,
You'll be so lonely you could die.
and others. Elizabeth Vargas anchors Elvis Viva Las Vegas, Tuesday, September 18th, starting at 9 p.m. Eastern Time. Thanks for watching tonight. I'm John Stossel, and for all of us at 2020 and ABC News, we're in touch, so you be in touch.